Diastasis. For many people, the word means nothing until they discover it may explain years of unexplained abdominal weakness, persistent back discomfort, or a stomach that never seemed to recover despite countless hours in the gym. The condition is far more common than most people realize, yet it remains widely misunderstood. For decades, public perception has reduced it to a problem affecting women after pregnancy. Medical evidence, however, paints a much broader picture. Men can develop it, children can experience it. Women who have never been pregnant may also have it, yet despite its prevalence, misinformation continues to spread, leading thousands of people toward unnecessary fear or, in some cases, unnecessary surgery. Point that misunderstanding creates an important question. If so many people have this condition, why do so few understand what it actually is? The answer lies partly in how rarely it is explained in plain language. Many patients hear technical terminology during a brief medical consultation, but leave without truly understanding what has happened inside their own body. Others turn to social media, where dramatic before and after stories often blur the line between evidence-based advice and marketing. Point to understand diastasis recti. It helps to begin with the anatomy of the abdominal wall. Running vertically along the front of your abdomen are two long bands of muscle commonly known as the six-pack muscles. These are the rectus abdominis muscles, positioned side by side. Holding them together in the middle is a dense strip of connective tissue called the linea alba, Latin for white line. Unlike muscle, this structure is composed primarily of collagen-rich connective tissue. Its role is simple but essential. It stabilizes the abdominal wall by keeping the left and right muscles connected, while allowing enough flexibility for normal movement. Point the linea alba does not function alone. It is integrated into an extensive network of fascia, a continuous sheet of connective tissue surrounding muscles throughout the body. This fascial system distributes force, provides structural support, and helps transfer movement between different muscle groups. When healthy, the tissue remains firm yet flexible, allowing the abdomen to withstand changes in pressure during everyday activities such as lifting, coughing, exercising, or even breathing. Point the problem begins when that connective tissue gradually loses its ability to resist stretching. Instead of remaining taut, the linea alba becomes thinner and more compliant. Under repeated internal pressure, it slowly widens. As that widening continues, the two rectus muscles drift farther apart, creating the separation known as diastasis recti. Point pregnancy remains the most recognized cause because the growing uterus places continuous pressure on the abdominal wall over many months. During pregnancy, hormonal changes also increase ligament and connective tissue flexibility to prepare the body for childbirth. In many women, these changes resolve naturally after delivery. As the uterus returns to its normal size and abdominal pressure decreases, the connective tissue gradually regains strength, allowing the muscles to move closer together. Point however, recovery is not identical for everyone. Genetics, age, nutrition, connective tissue quality, multiple pregnancies, obesity, heavy lifting, chronic coughing, and repeated increases in abdominal pressure can all influence how well the tissue recovers. In some people, the separation narrows significantly within months. In others, the gap persists long after childbirth. Point importantly, not every separation represents disease. A small gap, particularly around 1 to 2 centimeters above the belly button, in the months following childbirth is considered common, and may simply reflect the normal physiological changes of pregnancy rather than a condition requiring intervention. This distinction is crucial because many people become alarmed after discovering a small separation online, believing that surgery or aggressive treatment is inevitable. Point in reality, management depends on symptoms rather than appearance alone. Some individuals with relatively wide separations experience little discomfort, while others with smaller gaps struggle with weakness, instability, or reduced core function. Modern rehabilitation increasingly focuses not merely on closing the gap itself, but on restoring strength, coordination, and function of the entire abdominal wall. As awareness grows, so does the importance of separating evidence from misconception. Understanding what diastasis truly is, And what it is not is the first step toward making informed decisions about treatment, rather than reacting to fear or misinformation. For many people, the moment they discover a separation in their abdominal wall, the instinctive reaction is to search for exercises that promise the fastest possible fix, within minutes. They are confronted with thousands of workout videos claiming to flatten the stomach, strengthen the core, or close the gap in just a few weeks. But this is where one of the biggest misconceptions surrounding diastasis recti begins. Not every exercise strengthens the abdominal wall in a beneficial way. In fact, some of the most popular core exercises can temporarily increase the very forces that contribute to the separation point. Think about what happens during a traditional sit-up or crunch. As the upper body lifts off the floor, the abdominal muscles contract forcefully while pressure inside the abdominal cavity rises. That pressure has to go somewhere. If the connective tissue along the midline is already weakened, the increased force can cause the abdominal wall to bulge outward rather than stabilize inward. Instead of encouraging the muscles to work together efficiently, repeated high-pressure movements may place additional strain on the linea alba, particularly in individuals whose connective tissue has not yet recovered sufficient strength point. This does not mean abdominal exercise itself is dangerous. Rather, it highlights an important principle increasingly emphasized by physical therapists and rehabilitation specialists. Successful recovery depends on how pressure is managed throughout the core, not simply on how hard the muscles contract. The body functions as an integrated system involving the diaphragm above, the abdominal muscles around the trunk, the pelvic floor below, and the muscles of the back surrounding the spine. When these structures coordinate properly, they create stability, while minimizing unnecessary stress on vulnerable tissues. That is why many rehabilitation programs now prioritize controlled breathing, gentle activation of the deep abdominal muscles, and gradual progression before introducing more demanding exercises. Instead of chasing fatigue or burning sensations, the goal becomes restoring efficient movement patterns. In many cases, patients discover that improving control is more valuable than performing hundreds of repetitions of traditional abdominal exercises. Another major crossroads appears when surgery enters the conversation. Individuals with larger separations, sometimes 4, 5, or even 8 centimeters wide, are often referred for surgical consultation, especially when accompanied by hernias or significant functional impairment. Surgical repair has an important role in modern medicine and can dramatically improve quality of life for carefully selected patients. Minimally invasive techniques, reinforced sutures, and mesh placement have all advanced considerably over recent decades. However, surgery is not automatically the first or the only solution. Every operation carries benefits, limitations, and potential risks. General anesthesia, postoperative pain, infection, scar formation, recurrence, and recovery time are all considerations that patients and surgeons must weigh together. Experienced surgeons often remind patients of a timeless principle in medicine: the best operation is the one that is genuinely necessary. If conservative treatment can restore adequate function and relieve symptoms, avoiding an operation may be the preferable path. This perspective has gained increasing attention as research continues to demonstrate that many people with diastasis recti improve substantially through structured rehabilitation. While not every gap completely disappears, improvements in strength, posture, pain, and daily function often matter far more than achieving perfect anatomical appearance. For some individuals, the visible separation narrows over time as muscular coordination improves. For others, the gap remains measurable, but becomes functionally insignificant because the abdominal wall is once again capable of supporting normal movement. The broader lesson extends beyond diastasis itself. Modern healthcare is gradually shifting away from treating medical conditions solely through structural correction. Instead, greater emphasis is being placed on restoring function, encouraging long-term lifestyle changes, and empowering patients to participate actively in their own recovery. Nutrition, regular physical activity, healthy body weight, smoking cessation, and adequate sleep all contribute to tissue healing, in ways that no single procedure can fully replace. This is especially important because connective tissue adapts slowly. Unlike muscle, which may become stronger within weeks of consistent training, collagen remodeling occurs over months. Recovery therefore requires patience. Many people abandon appropriate rehabilitation simply because they expect dramatic visual changes within days. In reality, gradual improvement is often a sign that biological healing is occurring exactly as expected. The temptation to search for instant solutions is understandable in an era dominated by social media transformations and dramatic success stories. Yet the strongest evidence continues to support a balanced approach. Obtain an accurate diagnosis. Understand the severity of the condition. Work with qualified healthcare professionals when necessary. And recognize that sustainable improvement usually comes through consistent rehabilitation rather than quick fixes. For many individuals, that combination proves far more powerful than either inactivity or rushing toward an operation before conservative options have been fully explored. Once people understand that diastasis recti is not simply a cosmetic issue, but a condition involving connective tissue and core function, the next logical question becomes, why does it develop in some people but not in others? Pregnancy may be the most visible trigger, yet it is rarely the entire story. Two women can experience similar pregnancies, carry babies of comparable size, and follow nearly identical lifestyles. But one recovers with minimal separation, while the other struggles with persistent abdominal weakness for years. That difference points towards something deeper: the quality and resilience of connective tissue itself. Connective tissue is the body's structural framework. It supports muscles, stabilizes joints, reinforces organs, and forms the collagen-rich network that gives strength to tendons, ligaments, fascia, and the linea alba. Like any biological tissue, its condition depends on a combination of genetics, age, nutrition, hormones, physical activity, and overall health. Some individuals naturally produce stronger, more resilient collagen, while others inherit connective tissue that stretches more easily or repairs itself more slowly. This helps explain why diastasis recti is often associated with a wider pattern of physical changes rather than existing as an isolated condition. People with weaker connective tissue may also notice stretch marks that developed easily, joints that feel unusually flexible, recurring back discomfort, or veins that become more prominent over time. These observations do not automatically indicate a medical disorder, nor do they mean that everyone with diastasis has a systemic connective tissue disease. Instead, they illustrate that the strength of connective tissue varies considerably among individuals, influencing how different parts of the body respond to physical stress throughout life. Nutrition also plays a meaningful role in tissue maintenance. Collagen synthesis requires adequate protein as well as vitamins and minerals that support the body's natural repair processes. Vitamin C contributes to collagen formation, while nutrients such as zinc and copper participate in connective tissue metabolism. Vitamin D is widely recognized for its importance in bone and muscle health, and deficiencies may affect overall musculoskeletal function. Although correcting vitamin deficiencies alone is not a proven treatment for closing diastasis, nevertheless, maintaining balanced nutrition provides the body with the resources needed for healing and adaptation during rehabilitation. Another important factor is the way pressure is generated inside the abdomen during daily life. Heavy lifting performed without proper technique, chronic constipation requiring repeated straining, persistent coughing caused by smoking or lung disease, and excess abdominal weight can all repeatedly increase intra-abdominal pressure. Over months or years, these forces may contribute to continued stress on an already weakened abdominal wall. This is why rehabilitation often extends beyond exercise alone, addressing body mechanics, breathing strategies, bowel health, weight management, and smoking cessation may all form part of a comprehensive recovery plan. Scientific research over the past decade has increasingly emphasized that successful treatment should focus on restoring the function of the core canister. This concept describes the coordinated action of four major components: The diaphragm at the top, the deep abdominal muscles surrounding the trunk, the pelvic floor below, and the muscles supporting the spine at the back. When these structures activate in harmony, they distribute pressure evenly throughout the abdomen, reducing unnecessary strain on vulnerable tissues, while improving stability during movement. That integrated perspective represents a significant shift from older rehabilitation approaches, which often focused exclusively on strengthening the visible abdominal muscles. Today, many physical therapists begin with breathing exercises, posture correction, pelvic floor activation, and gentle engagement of the transverse abdominis, the deepest abdominal muscle, before progressing toward more demanding activities. This gradual progression allows connective tissue time to adapt, while reducing the risk of excessive stress on the healing midline. AGE is another factor that cannot be ignored. As people grow older, collagen production naturally slows, and tissue repair generally becomes less efficient. This does not mean recovery becomes impossible after 40 or 50. Rather, it means expectations should remain realistic. Healing that might occur relatively quickly in a younger individual may require additional months of consistent effort in an older adult. Understanding this biological reality can prevent frustration and reduce the temptation to abandon rehabilitation prematurely. Perhaps the most encouraging message is that improvement does not always require perfection. Many patients become discouraged because they focus entirely on eliminating every millimeter of separation. Yet clinicians increasingly evaluate success using broader measures: reduced pain, improved posture, better balance, stronger lifting capacity, enhanced confidence in daily movement, and greater quality of life. A person whose gap remains measurable but who can move comfortably, exercise safely, and perform everyday tasks without limitation has often achieved a highly successful outcome. Ultimately, diastasis recti should be viewed not as a simple defect demanding an immediate fix, but as a signal inviting a more comprehensive assessment of core health. When recovery addresses movement patterns, nutrition, connective tissue support, and long-term physical conditioning together, the benefits frequently extend well beyond the abdominal wall itself, improving overall strength, resilience, and function for years to come. If recovery depends on restoring strength rather than simply hiding the appearance of a gap, then the next question becomes obvious. What kind of movement actually helps the abdominal wall recover? For years, fitness culture promoted one message above all others: do more crunches, more sit-ups, more repetitions. A stronger core, many believed, could be built by repeatedly bending the torso toward the knees. But rehabilitation specialists have gradually shifted away from that philosophy, recognizing that effective core function depends less on aggressive movement and more on controlled stability. One of the simplest concepts used in rehabilitation is learning how to activate the deep abdominal muscles without creating excessive outward pressure. Instead of forcing the stomach to bulge during exercise, the objective is to gently engage the muscles that wrap around the abdomen like a natural support belt. This controlled activation encourages the abdominal wall to work as a coordinated unit, rather than allowing pressure to concentrate along the weakened midline. A commonly recommended technique involves gently drawing the abdomen inward, imagining that the belly button is moving toward the spine without holding the breath or tensing the shoulders. The movement appears almost effortless from the outside. Yet many people quickly discover that maintaining this contraction while breathing normally requires considerable muscular control. Unlike explosive exercises, this approach emphasizes endurance, coordination, and awareness rather than brute force. As strength improves, these gentle contractions can be incorporated into everyday life. They can be practiced while standing in line, walking through a park, sitting at a desk, or climbing stairs. This is one reason rehabilitation professionals often encourage consistency over intensity. Small, frequent periods of proper muscle engagement performed throughout the day may reinforce healthy movement patterns far more effectively than one exhausting workout followed by hours of poor posture. An uncontrolled abdominal pressure point progression remains essential. Once the deep stabilizing muscles begin functioning more efficiently, additional exercises can gradually be introduced under appropriate guidance. These may include modified planks, controlled bridges, side-lying exercises, functional squats, and carefully supervised resistance training. The emphasis is always on maintaining good control of the abdominal wall, rather than chasing increasingly difficult movements simply. For the sake of challenge point recovery also extends beyond exercise itself. The postpartum period deserves particular attention because the body undergoes remarkable changes in a relatively short time. During pregnancy, the abdominal wall gradually accommodates the growing uterus over many months. After childbirth, however, the internal environment changes almost immediately. The uterus begins shrinking, abdominal pressure decreases, and muscles that have remained stretched for an extended period must gradually adapt. Once again, healthcare providers may recommend abdominal support garments for selected individuals during the early postpartum weeks, particularly when they improve comfort or assist with mobility. While these garments should not be viewed as treatments that close diastases on their own, they may provide temporary support while normal movement and rehabilitation begin. Their role is supportive rather than corrective, helping some individuals feel more stable during the initial stages of recovery. Patience becomes especially important as people grow older. Collagen remodeling slows with age, and connective tissue generally requires more time to respond to training than skeletal muscle. Someone in their 20s may notice functional improvements relatively quickly, whereas individuals in their 40s, 50s, or beyond may experience slower but still meaningful progress. This difference reflects normal biology rather than failure. Consistency often proves more valuable than speed. Another factor frequently overlooked is posture throughout daily life. Hours spent sitting with a collapsed trunk, repeatedly lifting heavy objects using poor mechanics, or habitually holding the breath during exertion can all place unnecessary stress on the abdominal wall. Rehabilitation therefore extends into ordinary activities. Learning to stand, lift, cough, carry children, or rise from bed with better mechanics can reduce repetitive strain and reinforce the benefits gained during formal exercise sessions. Psychological expectations also deserve attention. Many people begin rehabilitation expecting dramatic visual changes within 2 or 3 weeks because online transformation videos often highlight exceptional results, while ignoring the months of disciplined work behind them. In reality, connective tissue heals gradually. Visible improvements may occur slowly, while functional gains, better balance, stronger lifting ability, reduced back discomfort, and improved confidence often appear much earlier. Recognizing these milestones helps maintain motivation during the recovery process. Ultimately, successful rehabilitation is rarely defined by achieving a perfectly flat abdomen. Instead, it is measured by restoring the body's ability to move efficiently, protect the spine, support everyday activities, and reduce symptoms that interfere with quality of life. When exercise, nutrition, healthy movement habits, and realistic expectations come together, the abdominal wall often becomes stronger than many patients believed possible. Recovery is not about forcing the body to return to an earlier version of itself overnight. It is about giving it the conditions it needs to rebuild strength steadily, safely, and sustainably. As the evidence surrounding diastasis recti continues to evolve, one conclusion has become increasingly clear. Recovery is rarely determined by a single exercise, one supplement, or one medical procedure. Instead, lasting improvement usually comes from understanding how the entire body functions as an interconnected system. The abdominal wall does not work in isolation. Every breath you take, every object you lift, every step you walk, and every movement you perform involves coordination between muscles, connective tissue, posture, and the nervous system. When one part of that system weakens, the effects often extend far beyond appearance alone. For people living with diastasis recti, the first priority is not panic, it is information. A visible bulge or measurable gap should be treated as the beginning of an assessment, not the final diagnosis. Healthcare professionals often evaluate several factors together: the width and depth of the separation, the quality of connective tissue, the presence of abdominal wall tension, symptoms such as pain or instability, and whether an associated hernia exists. These details determine the most appropriate management plan, far better than the measurement of the gap alone. One of the most encouraging developments in recent years is the growing recognition that many individuals can achieve meaningful recovery without surgery. Through progressive rehabilitation, improvements in muscular coordination, healthy weight management, balanced nutrition, and gradual strengthening of the core, countless patients regain confidence in their daily activities. They lift their children without fear, return to exercise, improve posture, and reduce back discomfort, not because every millimeter of separation disappeared, but because their abdominal wall functions efficiently once again. That does not diminish the importance of surgery when it is truly indicated. Certain patients experience severe functional impairment, recurrent hernias, persistent pain, or large separations that fail to improve despite comprehensive rehabilitation. In these situations, surgical repair performed by experienced specialists can provide substantial benefits. The key message is not that surgery is inherently good or bad. It is that treatment should match the individual patient's condition rather than follow a one-size-fits-all approach. This broader perspective reflects a significant change occurring throughout modern medicine. Increasingly, healthcare is moving away from simply treating visible structural abnormalities and toward improving overall function and long-term well-being. Rather than asking only, can we close the gap? Clinicians are asking, can this person move comfortably, protect their spine, perform everyday tasks, and enjoy a better quality of life? These functional outcomes often matter far more to patients than achieving a textbook anatomical appearance. The conversation also highlights the importance of public education. Misinformation spreads rapidly through social media, where dramatic claims frequently outperform careful explanations. Some creators promise miraculous cures within days. Others insist that surgery is inevitable for every noticeable separation. Reality lies somewhere between those extremes. Scientific evidence supports conservative rehabilitation for many patients, while recognizing that some individuals will ultimately benefit from surgical intervention. Understanding this balance allows people to make informed decisions rather than reacting to fear or unrealistic expectations. Preventive strategies deserve equal attention. Maintaining a healthy body weight, practicing proper lifting techniques, avoiding unnecessary straining during bowel movements, treating chronic coughs promptly, remaining physically active, and strengthening the core before and after pregnancy can all contribute to better abdominal health. Expectant and postpartum mothers in particular benefit from guidance provided by qualified obstetricians, physiotherapists, or rehabilitation specialists who understand the unique demands placed on the abdominal wall during pregnancy and recovery. Perhaps the most valuable lesson is that healing takes time. Connective tissue remodels gradually, muscles adapt progressively, and movement patterns improve through repetition rather than overnight transformation. The most successful recoveries are often built on months of consistent effort rather than weeks of intense training. Patience, combined with evidence-based rehabilitation, frequently produces results that quick fixes cannot sustain. If there is one message to remember, it is this. Diastasis recti is not merely about appearance. It is a reminder that the body's support system deserves attention, care, and informed management. By seeking accurate medical evaluation, following appropriate rehabilitation, maintaining realistic expectations, and focusing on long-term function instead of short-term cosmetic goals, many individuals can restore strength, improve confidence, and reclaim the activities that matter most in everyday life. The journey may require commitment, but for countless people the reward is a healthier, stronger, and more resilient body, not only across the abdominal wall, but throughout the entire musculoskeletal system.